Welcome to the Back Pain Solutions podcast again with me, Ben James, and as always, my co-host Jacob Spain. Afternoon, Jacob.
Hey Ben, good morning.
So today we are talking about squats, deadlifts. Why is my back hurt after doing a squat or deadlift? Jacob, you had a patient recently. Often we'll get these patients to ask you specifically about certain exercises and certain things they can do, should do, shouldn't do. And this patient was specifically asking, why is my back hurting after a squat or a deadlift? And also, should you be doing them? What's the most effective way to strengthen your lower back? So, Jacob, why don't you give us a bit of background on this, a bit of context, and then we'll kind of dive in. I'll ask some questions around it just so that the listeners get a kind of an overall picture of those couple of exercises and what maybe they should be doing first to focus on strengthening their lower back and things they can do that are more effective potentially and safer than those exercises depending on what stage they're at with respect to their recovery.
So I'm going to cover two things today, Ben. We're going to quickly talk about why my back hurts when I deadlift or squat, and then we're going to talk about your second part that you mentioned, the way how to effectively strengthen your lower back, right?
Sure.
So just to get to the first one, the squat and deadlift they're quite different movements. And if we look at the squat, it's a typical pattern where we're using the back muscles too much. We're going into a position from standing and lowering the body down, usually with weight on the shoulders, giving too much work to the low back. And that results in literally you actually causing so much compression through the spine that then causes irritation or hurts. Could get a lot worse than that if you keep doing that.
And presumably that's even when, even with someone that's keeping a good neutral spine and good brace through the low back, are there cases whereby they might be nicely neutral, they might be holding that neutrality and bracing, but the compression with those particular individuals is too much that could be leading to back pain?
No, generally, if you maintain a neutral spine, you're gonna the pressure coming through your back is going to be a lot less than when you actually go into a increased lordosis. In other words, if you overarch your low back,
Got it.
and that's when you really increase the pressure. You lose the absorption throughout the spine of the pressure, making it more focal in the lower back when you actually arch the back. But you're also losing the protection of the front of the abdominal wall, which kind of it's the antagonist of your back muscles. So that's actually working together with the back to concentrate the force through the spine. And we're not talking about the shear forces, we're talking about the axial force. And that really protects the spine a lot more than when you actually let go of the front of your abdominal wall, which happens when you arch.
Sure.
Yeah, so we lose this connection between the rib cage and the pelvis at the front. Therefore, the low back muscles are really doing much more work than they should. And that takes the lumbar or the low back spine out of its neutral position, but it also causes a hell of a lot more pressure through the spine.
Sure. Got it.
Um, when we look at a deadlift, the typical problem there, especially if we pull from the floor, is that we're not able to maintain that neutral spine in the bottom position.
Yeah. So
Like
we've
whether it's going
arched.
whether it's
Yeah.
going whether we're going down or coming from the bottom up. Usually we pick up a deadlift from the floor,
Yeah.
whereas squat we start at the top. That means it's really that bottom position. Or if we do CrossFit or something where we have repeated repetitions, then we decelerate going down, and then we accelerate going up again. And that's really the difference. So the real problem is that bottom position. It's whether you can actually keep your back in a nice flat neutral instead of actually losing it and going in the opposite direction and rounding your lower back.
Yeah. And do you have any thoughts, interestingly, on that point about deadlifts? Because I often get this. whereby, let's say we're keeping our back nicely neutral as we deadlift. Some patients seem to find it really difficult to kind of get the bum down. So keeping that kind of, let's say we're at an angle here, we're neutral spine, we're getting the bum lower. Some patients find getting the bum low is hard, but they're through the hips, but they're still neutral. So their back is essentially more parallel to the floor through the hips versus their bum closer to the floor. Does that make sense? Any views on that?
Yeah. So, I mean, there are different ways to do a deadlift. Actually, many different ways to do a deadlift, and it's also very much dictated by body type.
Sure.
You know, and if we do a powerlifting deadlift where we're really sitting back, we have to get the bar over our lower leg. So we have to get that bar over the knee, and from there we can really stand up. That's quite different to when we're keeping the bum up high, dropping the chest, and using more of a thrust to get it up.
Sure.
So, and I was asked this recently. We had a discussion in the group about this. If you can't, if we can't pull from the ground and pull from a raised surface, then we really can't get hamstring tension. And I think the answer there is more you need to be able to turn your hamstrings on independent of the position,
Right.
if you know what I mean.
Yeah.
So, but obviously, if we want to protect the back, we want to be more upright. So we want to be able to drop the bum, keep your shoulders up, and then drive with the hips the weight from the floor. But with a deadlift, there's going to be a lot more pressure going through the back because we're really much more forward, leaning over to get it off the floor.
Yeah.
And so the difficult thing becomes that bottom position where we're actually, some people are going to have a very difficult time getting into that bottom position with a good back, um, being able to maintain that back as soon as they start lifting that weight off the floor. And so that's really, in a nutshell, the reason why people are having pain after a squat or deadlift. It's because they haven't honed in that posture they need. Quite often, the bracing, compression, or co-contraction that goes along with it in order to maintain your core, the neutral spine. And that's something you have to really drill in, work on. Takes time to build it up. Get some advice on, am I doing it correctly? Listen to your body when it hurts. You know, don't just push through. If you're a real athlete, you know when it's just muscle pain or when it's pain from actually working hard or when it's a bad pain that's
Hmm.
something that's new or doesn't shouldn't be there,
Sure. Yeah. Yeah.
right? But when you're not so familiar with what you're doing, then quite often we think, okay, I'm having pain, but I'm working hard, my body's adapting, it should be fine, I'm carrying on. You have to be careful for that.
Right. Yeah. 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 And that comes with some experience. I think it's fair to say, because if you know your body well and how you respond to training, then you'll know the difference. And sometimes you'll get patients that come in and say, "Oh, a bit of training, and I feel a bit of this," and a lot of it's reassuring that I think you're fine. That it's just some kind of post training soreness that you've got. There's no injury there. Whereas I
Yeah.
think so they I think you got to know your body well. So I think those patients are sensible in that they're getting that reassurance and that advice. Do you know what? You're good. Just keep going. It's just, some of it is just conditioning for those individuals to get that, and then we want, of course, progressive overload over time for some. But I think that's a really relevant point. But it would just be careful if you are inexperienced that you maybe get some input versus just kind of assuming it might just be from doing a certain workout. I would suggest.
Yeah, I think that, so basically, to answer that, it's that body positioning awareness,
Yeah.
and that takes time. It's something you have to be busy with for some time. You have to be uh, you have to make it a priority, and that's how you get the feedback you need from your body with a certain weight, or whether you do a higher weight or a lower weight. It's very important. If you don't do that often enough, or you don't get some feedback when in doubt, um, then I would suggest just be very careful with that.
Yeah. Yeah.
And then the second part, Ben, that you mentioned was, how do I effectively build core strength? How do I get my back strong?
Yes.
I mentioned already earlier, we talked about bracing, compression, co-contraction, right? So there can be a few obstacles, and we're going to touch on a few that could stand in the way of actually creating a strong core. Uh, One is called lower cross syndrome. And lower cross syndrome is actually that aspect of we're losing neural drive or activation of the abdominal wall in the front and the gluteal muscles. And the result of that, quite often, is too active lower back muscles and tight hips at the front,
Hmm.
which means that pelvis is tilting forward. And so, if I want to do a plank, for example, I go into a front plank on my elbows and feet, it's going to be very difficult to open up my hips, straightening my low back, which means it results in a arching of my low back. So I'm doing a plank with my low back muscles, whereas really I want to do it with opening up my hips and get my abdominal wall in the front to actually do the work,
Right.
right? Um, so that's one obstacle that's quite often in the way I see when I work with people of really developing a strong core, and it's a physical problem that is by far in most cases, resolvable,
Okay.
right? So it's opening up the hips, get some glute activation going, and then if you get into a plank, whether on your knees or on full plank or whatever front plank variation you're doing, being able to open or extend the hip properly and therefore get your abdominal wall to really do the work it should. So then you build strength in the right way,
Sure.
right? So that's the first aspect. If we then look at bracing, I like, for example, the baby 3 month supine from DNS technique, where we're lying on the back. It's a sort of dead bug, but your knees are just above your hips. So nothing challenging other than being able to brace. And you can check that with your fingers by just squeezing on the side of just above your pelvic bone, in your side. So you're squeezing and you're bracing, so you're pushing your fingers out. So you feel the tension in your core and you're maintaining that while you breathe,
Yes.
right? And so we want to try and uncouple the breathing from the bracing. It's never going to happen. We can't uncouple them, but that's our aim. And the better we get at that, we would be able to keep the brace on while we're breathing,
Yes.
right? And the focus of this exercise is really that diaphragm activation. And that just means we're able to incorporate your diaphragm when we need to create some abdominal pressure, whether moving a chair or lifting a table or something explosive or more sport specific, performance driven, right?
Yeah.
So that's getting the brace, working on the brace. Second thing is the compression aspect. So compression between the shoulders and the pelvis. That's happening for a big part by using the latissimus, the lats, these wide muscles on the side of your upper body. So upper back muscles that really give you that sort of V shape if you're a bodybuilder. They connect the shoulder with the core or low back pelvis. But they're more. They are the lower trapezius muscle. In the front, there are a few. We're talking about the chest muscle going through the fascia, connecting to the abdominal muscles. So really, when I'm standing upright and I'm pushing my hands to the floor, so I'm compressing my shoulders down, I'm creating this connection between the shoulders and the pelvis. And we talk about compression, right? Similar to a sprinter. If a sprinter runs fast, there's incredible compression. That's why they're so muscular, because they have to maintain that compression, that proximal stability, in order to create speed and strength through the hip and the shoulder. The moment they lose the shoulders, we talk about an energy leak. But that's in most cases the situation.
Yeah.
Third aspect is the co-contraction. So if we take the hip, for example, it's a good example. We have the psoas muscle in the front and we have the gluteus buttock muscle in the back. So the psoas muscle people don't generally don't know about. You don't specifically see it. It's running over the front of the hip from the low back to the upper thigh bone. And so what happens quite often is we lose this activation of the gluteus muscle, the buttock muscle, and the hip muscles really become short and tight. And that's now my hip protection. Instead of a well activated gluteal buttock muscle, that should really be the main driver of my hip and really give that protection that my brain feels when I do stuff with my hip. And so we see that co-contraction going in the wrong direction if we know that we have buttock inhibition and we get hip flexor over action or over neural drive. And so if we can fix that and we get that balance between the front and the back, multiple places, whether low back or hip joint, if we fix the co-contraction, we're balanced and we can call upon the back or the front whenever needed, depending on the exercise. And so those are the three aspects I would recommend you focus on is learning how to brace, connecting your shoulder blade to your low back using compression. So in other words, get the activation of your lats and the other muscles that really causes the compression to happen, get that going. And then the third aspect would be the co-contraction. So open up your hips, get some glute activation, for example. You know, those would be my three biggies go to for better back strength and core conditioning.
Yeah, and I would, I think, there's some really valuable content there, for anybody is my feeling, because often I've seen so many patients over the years that I don't do deadlifts anymore. I don't do them, because it affects my back. And my argument always is if your back's been well rehabilitated with the right advice, squats, deadlifts should be perfectly reasonable exercises for you to, you know, progressively get back to, right? But I think if you haven't had those fundamentals, and also if you're doing these exercises and you've never had back pain, the chances are you're not doing some of those fundamentals. So you're either at risk of re-injury or you're risk of injury just simply because you're not employing some simple strategies that if you know and understand and can practice, then you would make yourself so much more resilient to injury. And not only that, you would make those exercises just far more effective and far better executed. And you probably find that you could gradually lift greater, heavier weights as a result. Because I think, so often I'll see patients or individuals in the gym where I train, they'll be doing a deadlift, they'll be doing a squat, and they're kind of just, completely holding their breath throughout, trying to do 10 repetitions, you know, rather than
Yeah,
learning to brace and breathe, brace and breathe. That should be achievable. We should be able to brace here and breathe at the same time, and therefore you're creating and sustaining that abdominal pressure whilst doing that exercise, rather than holding your breath. Or you're breathing but you're losing that brace, and then you are incredibly vulnerable. So, I think those strategies are not necessarily just over the podcast here are easy to kind of visualize and understand. And as always, we've got videos and content that you can, reach out to us and learn more about to support. But I would advise, if you're listening to this and you lift or you've had some back pain, which is probably the greater majority, then don't feel you can't do those exercises again, but maybe there's some basics, some fundamentals that you need to do first before then getting back to lifting reasonable weight. Sorry, Jacob, you're gonna.
yeah. I wanted to say just to add on to that quick look. I mean, what quite often when you're young, the goal is to see how much you can lift. But what we really want to do is we don't want to see how much we can lift at a great cost.
No.
If we squat on a regular basis and we squat at 50, 60 kilograms when we know we can easily squat more than 100 kilograms, is there any value to doing that? Of course, if you squat with a medium weight, you're still getting that compression on the spine, which is very healthy. You are working the right muscles that you need whenever you're going to be doing something like that in a different situation. So it's about the fact that you squat, not how much you squat. It's the fact that you do it regularly, and that's really stimulating the program from your brain when you're going to be needing it for doing something around the garden, or and so it really is about the stimulation you give the body and on a regular basis, and much more has a lot more value than doing it, you know, keep going heavier and heavier. There's really very little point in doing that unless you have some personal goals, but it's not the real reason why we squat or deadlift.
No, no,
Yeah,
no. And I think you're right. This kind of this objective of just lift heavier, heavier, heavier. It's often more the aesthetics of looking bigger and being bigger. And I can understand that. We all go to the gym to some extent, not just for health, but for for aesthetic purposes. I think, which is fair enough. But there's always a balance, and there's always a risk reward. And actually, you know, by lifting weights well, learning fundamentals, you're at the very least reducing your risk of injury if your objective is to lift heavier or just get bigger. Just make sure you do the basics first, because what you don't want to do is get injured and then not be able to train at all, because then that's going to lead to real frustrations. If you, like myself, like you, Jacob, get a lot, both physically and mentally from going to the gym, exercising and staying fit. So I think, as always, you know, if you are suffering from back pain, if you are suffering back pain after a deadlift or a squat that doesn't feel like it is just post muscle soreness, then just be cautious with that exercise, and sometimes just take a step back. And having listened to this episode, then really think about some of those key things that you mentioned there, Jacob. Are you doing those fundamentals well? Do you even know about them? Do they even make sense to you? Because if they don't, then the chances are that you're not optimizing that technique, and therefore you're putting your body at risk and potentially irritating tissues that could quite easily lead to an injury that we want to avoid. So if you are unsure, if you want some more information, as always, reach us, info@smartstrong.co.uk. We'd be happy to answer the questions, even set up a call just to discuss, just to give you any advice that might be helpful. We're always here. So thanks again for listening, Jacob. Thank you. And we'll be back again soon with another episode.